presenters have been compensated for their time.
Welcome to Rapid Recaps, your place to explore the challenges of chronic spontaneous urticaria, or CSU, and learn more about RHAPSIDO or remibrutinib. In each episode, experts share knowledge to help healthcare professionals like you navigate CSU management with confidence. My name is Dr. Michael Blaiss, and I'm joined by my colleagues specializing in CSU. Two leading experts from allergy and dermatology will share their insights on CSU, a condition that may present across specialties and in different clinical settings. Would you like to introduce yourselves?
Hello, I'm Dr. Priya Bansal.
And I'm Dr. Adam Friedman.
Welcome, and thank you for joining us. Before we dive in, it's important to note that RHAPSIDO is indicated for the treatment of chronic spontaneous urticaria in adult patients who remain symptomatic despite H1 antihistamine treatment and is not indicated for other forms of urticaria. Important safety information and a link to the full prescribing information can be found nearby this video.
In this video, we're going to look at the unique mechanism of action of RHAPSIDO, which was discovered and developed in Novartis laboratories. Let's investigate what's driving CSU symptoms. Dr. Friedman, will you get us started by reviewing the pathophysiology of CSU?
Although the pathogenesis of CSU has not been fully elucidated, it is believed to be primarily a mast cell-driven disease. Our understanding has expanded, no doubt, but it still comes back to that leading antagonist. Bruton's tyrosine kinase, or BTK, has an important role in the pathophysiology of CSU as one of the key mediators of mast cell degranulation, which promotes the release of histamine and so many other pro-inflammatory mediators. Let's take a closer look at BTK. So BTK is an intracellular kinase, so it's working inside the cell, and it's expressed in select immune cells, including mast cells. BTK is located downstream of the Fc epsilon receptor 1. This is the high affinity receptor on the surface of mast cells. There are a lot of cell surface receptors, but the main focus for so long has really been on this high affinity receptor. Now, what you can see here is that BTK can be activated by immunoglobulin E, or IgE, also referred to as the autoallergic pathway, or immunoglobulin G. Now, in the IgE pathway shown here, an autoantigen forms a complex with the Fc epsilon receptor bound IgE. So you have two IgEs that are linking on to this autoallergen. And when that happens, beneath the surface, BTK is activated, and that will cause subsequent mast cell degranulation. The auto-IgG can do the same thing that autoallergen is doing, and it can cross-link those IgE bound to the Fc epsilon receptor by itself. Intracellular BTK signaling is the one key mediator that leads to mast cell degranulation.
Dr. Bansal, how does RHAPSIDO fit into this picture?
With RHAPSIDO, clinicians have a targeted option to treat CSU after antihistamines. This first-of-its-kind oral treatment targets BTK, which, as Dr. Friedman mentioned, is a key driver of mast cell degranulation in CSU. So RHAPSIDO is a highly selective BTK inhibitor. But what exactly does that mean? The high selectivity of RHAPSIDO was demonstrated in a preclinical study. So in addition to BTK, RHAPSIDO was found to bind TEC and BMX kinases. However, it was 175 times and 857 times more selective for BTK versus those other kinases, with no clinically relevant affinity for those other tyrosine kinase families. To summarize, RHAPSIDO is inhibiting BTK, blocking IgE and/or IgG pathways that induce mast cell degranulation and the release of histamine and those pro-inflammatory mediators. By binding to BTK, RHAPSIDO offers a unique approach to the treatment of CSU. It is the first and only FDA-approved oral treatment for CSU that targets BTK, a key mediator of mast cell degranulation.
Thank you, Dr. Bansal. This was helpful and really paints a picture of the pathophysiology of CSU and how RHAPSIDO interacts with these mediators.
Indication: RHAPSIDO, remibrutinib, is indicated for the treatment of chronic spontaneous urticaria, CSU, in adult patients who remain symptomatic despite H1 antihistamine treatment. Limitations of use: RHAPSIDO is not indicated for other forms of urticaria. Important safety information. Warnings and precautions. Risk of bleeding. Mucocutaneous-related bleeding occurred in 9% of patients who received Rhapsido. Interrupt treatment with Rhapsido if bleeding is observed, and resume if the benefit is expected to outweigh the risk. Interrupt treatment with Rhapsido for 3 to 7 days pre- and post-surgery or invasive procedures. Use of antithrombotic agents concomitantly with Rhapsido may further increase the risk of bleeding. Consider the benefits and risks of antithrombotic agents when used with Rhapsido. Monitor for signs and symptoms of bleeding. The use of live and live-attenuated vaccines should be avoided in patients receiving Rhapsido. Adverse reactions. The most common adverse reactions, incidence greater than or equal to 3%, were nasopharyngitis, bleeding, headache, nausea, and abdominal pain. Drug interactions. Remibrutinib is a CYP3A4 substrate and a P-glycoprotein (PGP) inhibitor. Avoid use of Rhapsido with strong or moderate CYP3A4 inhibitors. Concomitant use with a strong or moderate CYP3A4 inhibitor increases remibrutinib exposure, which may increase the risk of Rhapsido adverse reactions. Avoid use of Rhapsido with strong or moderate CYP3A4 inducers. Concomitant use with a strong or moderate CYP3A4 inducer decreases remibrutinib exposure, which may decrease the efficacy of Rhapsido. Monitor more frequently for adverse reactions when using Rhapsido with PGP substrates where minimal concentration changes may lead to serious adverse reactions, for example, digoxin. Remibrutinib increases exposure of PGP substrates, which may increase the risk of adverse reactions related to PGP substrates. No data are available on concomitant use of Rhapsido with anticoagulants. The concomitant use of Rhapsido and anticoagulants was not allowed in clinical studies. Use of the antiplatelet agents acetylsalicylic acid at doses up to 100 mg daily or clopidogrel up to 75 mg daily was allowed in the Rhapsido clinical studies. Use in specific populations. There is a pregnancy exposure registry that monitors pregnancy outcomes in women exposed to Rhapsido during pregnancy. Avoid use of Rhapsido in patients with mild, moderate, or severe hepatic impairment, Child-Pugh class A, B, and C. Rhapsido exposure is increased in these patients relative to patients with normal hepatic function.
This wraps up this video. Thank you for watching Rapid Recaps on Rhapsido. We invite you to explore the other videos in the series to learn more about Rhapsido and its role in CSU treatment. Explore clinical insights and treatment considerations for CSU at rhapsido-hcp.com.